Hey everybody, what's up? Dr. Seth with the Cafe of Life Chiropractic Center. Welcome to our Body Signals Lower Extremity Falling Apart Syndrome webinar. We're glad you're here. We're going to be unpacking the lower extremities. Gosh, doesn't it just stink to have some of these different issues with the lower extremities? I take care of patients all day long, tens, hundreds of patients with lower extremity issues, hip issues, knee issues, foot issues. They're so annoying. They take us away from the passions that we're trying to do on a day-to-day basis, whether that's running after our kids or running up Mount Tam or skiing at Squaw or North Star. Lower extremity issues stink. And here at the office, we do everything that we can to try to keep patients as functional as we possibly can. Who here has dealt with the frustration of a hip issue or a knee issue? I take care of a demographic, a lot of them my age, right? Anywhere from 30 to, let's say, mid-70s. Obviously, I take care of infants and toddlers and children, but gosh, you start to get in 30s, 40s, 50s, 60s, we start to see all of the different issues that we have going on. Last month, we talked about upper extremities, shoulder issues, elbow issues, tennis issues. This month, we're talking about the lower extremities, and we're going to get into it. If you have these lower extremity issues, you know how painful and frustrating they can be. The pain is one thing, but the pain of it robbing your ability to do the activities that you want to do, that is another, and I feel it. I've been there, and I'm working with people day in and day out to try to help them move through these various different issues so they can get out, hit it hard, and suck the nectar out of life. So we're going to get right into it. If you've been experiencing these lower extremity issues, I'm there with you. I understand how frustrating it can be, but the good news is there's a lot that can be done about it. So today, we're going to unpack that. I'm going to ask you this. I'm going to get through this webinar pretty quickly. Attention spans these days are small, but because you're here, because you're watching this webinar, I'm going to ask you for this. You know, you're going to get the most out of this if you are focused in what it is that I'm saying, right? So put down the phone, put down the text, put down the scrolling. You know, if you're just half listening, you're gonna get as much out of this as you possibly can if you just give me your focus. All right, so if you can commit to that, give me a thumbs up, and we're just going to get right to it, okay? If you know someone that you're thinking about during this webinar, that, gosh, this person needs to hear it, share it with them, okay? So, all right, let's get into it. Let's see if I can get this platform moving here. We are going to, okay, give me a second here. Boom. All right, so falling apart syndrome, hips, knees. We're talking about the lower extremity. And in the lower extremity, lower extremity can lead to all different kinds of issues, right? Lower back pain, hip pain, knee problems, leg problems, ankle issues, foot problems. They're all interconnected, right? It's a closed chain. So if you have a foot problem, that could translate all the way up. Ankle issues, leg pain, knee problems, hip pain. They're all connected, right? And when we have lower back issues, those lower back issues can absolutely translate down the lower part into your hip. When your lower back is fixated and not moving properly, that can affect your sacroiliac joint, which is that joint, let me get it right here, that joint between your sacrum and your ilium, all right, when this doesn't move properly, that can translate all the way down and cause all different kinds of problems, all right? So we're going to get into them, but what we know is that it's a closed chain and they're all interdependent on one another, okay? We call it falling apart syndrome. When you get to our age, get to my age, falling apart syndrome is a very common syndrome, and I take care of patients all day long, okay? We're all talking about it. Gosh, you know, it's just not as easy to heal, and the recovery time takes longer, but there's a lot that can be done to speed up this process, get people back into doing the things that they love to do, all right? So we call this the Body Signals program. It's a condition-specific solutions, right? Symptoms are your body signals, your body's way of asking for help. So the question is, are you listening? All right? Pain is a sign, all right? You got to listen. Our society is a society where we're very uncomfortable with being uncomfortable. And so we have a pill for everything. We mask everything. But when you're starting to have these various different types of issues, trust me, one of the few most dangerous words that I hear with patients all the time are, "I thought it would go away." Really dangerous words, okay? Within a couple days, if that pain is still around and it's not moving anywhere, then get it addressed. Do something about it. We have to listen to our body, and when we listen to our body and we hear those signals, then we have to take action, right? So what do symptoms actually say about your health, right? So symptoms tell you what direction you're headed in. I love this chart right here. It's the illness wellness continuum. I use it on our intakes form at the office. But health is dynamic, right? It's always moving. It's never stagnant. You're either moving in one direction or the other direction. You're either moving towards premature death or a high level of wellness, but you're not staying stagnant, right? So most patients don't slide down a rainbow into my office. They usually have some signs and symptoms, right? But it's kind of, what kind of health are you looking for? And you just have to be honest with yourself. Are you looking for treatment and crisis care and just palliative care and are just looking to get out of pain, which is fine? That's a use for chiropractic. In my opinion, not necessarily the best use, but that's a treatment paradigm. Come in, you have symptoms, you have signs, you treat it, and you get rid of the symptoms. But we know that really only puts you into a neutral point, right? It only kind of puts you there. You're right there with what we call no discernible illness or wellness. You're not really sick, but you're not really healthy either. In our office, we subscribe more to the wellness paradigm, which is, people come in, they have various different types of symptoms, and we're doing our best to try to help them get rid of those symptoms as quickly as possible. Obviously, we want people to feel and function better as quickly as we possibly can. However, we're looking to create an awareness as to what caused the problem. And what caused the problem? What is it in your day-to-day activities? What is it in your lifestyle? Is it a sedentary lifestyle? Is it bending, lifting, and twisting all day with the children? Is it sitting at the computer, forward head posture, looking down at your phone all day? What is it in your lifestyle that is causing the issues that you're having today? And so we want to help educate patients about not only what we can do for them, but what can you do for yourself outside the office to get on top of the situation. And ultimately, we're trying to help patients grow into the healthiest human beings that we possibly can, because we want them to be high functioning and we want them to be as well as possible, okay? So symptoms kind of tell you, how many symptoms do you have? And are you moving in one direction or the other direction? And what is the momentum? How fast or slow are you moving in this direction? If you've been moving in the wrong direction for some time and you're gaining momentum in the wrong direction, that's bad news. So what we got to do is, first and foremost, we have to help stop the damage and stabilize the condition. So love this illness wellness continuum. Really just kind of lets people know, hey, health is dynamic. You're moving in one direction or the other. Which one do you want to be moving in? And at what pace do you want to be moving in as well? All right. So symptoms, symptoms also can be misleading, right? Feeling versus function. Interestingly enough, when we say that no symptoms are the worst symptoms at all, is because, in all reality, pain and sensory information, only 10% of our nerves in the body transmit pain and sensation. So just because you don't feel anything doesn't necessarily mean that you are doing well and that you are healthy, okay? Only 10% of the nerves in your body are sending pain and sensation signals. So you can have compression on various different structures and not know anything about it, right? So certainly I would say if you feel like crap all the time, chances are there's problems. However, just because you feel fine doesn't necessarily mean that you're doing well. And so getting evaluated and getting checked and making sure that everything is aligned properly and moving properly is a good idea, regardless of the symptoms that you're experiencing. Because oftentimes patients have no symptoms for a really long period of time, and this condition has been growing and growing and growing and growing. What we usually say is pain is the last thing in a process to show up, but it's typically the first thing to go away, all right? So symptoms oftentimes can be misleading. So let's unpack this lower extremity. Let's get into the anatomy. We have your lumbar spine. So if we start with your lumbar spine, we know that we have 5 lumbar vertebrae. The lumbar vertebrae, the fifth lumbar vertebrae, articulates into this what we call the sacrum. So we have the lumbosacral joint. The lumbosacral joint, from the lumbosacral joint are on both sides over here. Let me see if I can go here. Oh, that's hip problems. This is the SI joint, right? So if this is the sacrum down and through here, this is your L5 vertebrae in through here, and then you have your ilium that attaches to your sacrum on both sides and through here, and this is the SI joint. Let me go back a couple over here. So we have the lumbar spine, which is your lower spine, and that lower spine, we've got all different kinds of rotation in through there. We have the facet joints that prevent us from moving too much into rotation. We have the sacroiliac joint. When that lumbar spine is not moving properly and it starts to get restricted, that lumbosacral joint gets restricted, that can in turn create reduced mobility in the sacroiliac joint. Sacroiliac joint is responsible for so many downward stream conditions, right? Knee problems, foot problems, hip problems, oftentimes start up in the sacroiliac joint. So the lumbar spine, we have the lumbar spine, then we have the sacrum, then we have the sacrum that attaches to the ilium. The sacroiliac joint actually moves kind of like a figure 8, and when that gets stuck, gosh, we have a whole host of problems that go down. And I take care of people all day long with sacroiliac issues. It's uncomfortable, getting from a seated to a standing position, bending, twisting, sharp shooting pain, dull, achy pain, throbbing pain, all different kinds of pain can come from this sacroiliac joint. And of course, that is going to affect the pelvis and the actual femur inside the acetabulum, where you have your ball and socket joint. Then we have the knees, the ankles, the feet. It is a closed kinetic chain, and this whole thing is interdependent. All these different parts play on one another, and it can be a really tricky situation. So let's get into it. Hip problems, right? We have the hip problems. We have the ball and socket joint in through here. Here you can see a replaced hip in through here, but all kinds of problems start with the hip. You know what? My experience is that these hip issues oftentimes stem from biomechanical issues as a result of sacroiliac dysfunction or decreased motion in the sacroiliac joint and the lumbar spine. So when your lower spine gets misaligned, your sacrum and your ilium get misaligned, or they get stiff and they get rigid and they don't move properly, that starts for biomechanical issues with the ball and socket joint in your hip, and then that starts to lead to degradation or soft tissue problems with inside that hip joint. And when you start to get problems inside that hip joint with the tissues, eventually that will start to wear down. You'll start to get bone growth, and that's what leads to hip replacements and all kinds of nonsense like that. So hip problems, obviously a big issue. Lots that can be done. We care for patients with hip issues in the office all the time, but I can distract that hip. I can get in there, I can distract it, I can create better motion in that ball and socket joint. But if we don't get into the sacroiliac joint, get that moving better, make sure that your lumbar spine is moving properly, make sure that there's good imbibition or movement and good hydration of the discs in the lumbar area, it's not going to help too much with the hip problem. So those two interplay on one another for sure. Let's talk about, again, the SI joint subluxation, right? So taking a look at this right over here, you have your lumbar spine, and then from your lumbar spine, you have your sacrum, and then you have the ilium on both sides. Look over here on the side, you can see when you start to get misalignment of the sacrum, that is going to create a fixation inside that sacroiliac joint. I'll say it 1,000 times, this sacroiliac joint is the culprit for many conditions moving down from there. The hip, the knee, the ankle, the foot, oftentimes are downstream from these issues that you have going in through here, okay? So very important to get better mobility inside that SI joint. Remember that SI joint kind of moves like a figure 8 in through there. And so creating proper motion in there, proper alignment in there, Very important to help stabilize the issues that you have going down in the lower extremities. And again, we're going to get into them: the hip, the knee, the ankle, the foot. Certainly, we can treat those. We can introduce better motion into the joints of those, better motion into the joints of those areas. But if we don't go upstream and we don't look at the cause of this problem, it's just going to happen again. So we got to take a look at the whole thing. Let's go back here. Let's talk about this condition right here called subluxation, right? So I talk about subluxation, and you've probably heard me say it a couple times here. Subluxation is a chiropractic term which means misalignment of a vertebrae that puts pressure on a nerve. Now, could you have subluxation of an extremity? Yes, you can have subluxation of an extremity. But a subluxation is a joint misalignment, okay? So we have joint misalignment. That means that the joint is not aligned properly. When that joint is not aligned properly, that is going to create soft tissue damage. So soft tissue could be any number of different things. It can be a disc, muscles, ligaments, tendons, cartilage, whatever. But that soft tissue damage is then going to create inflammation. When we create that inflammation, from that inflammation, then we're going to get nerve irritation. All right? With that nerve irritation, that in turn, that nerve is irritated. So the body's smart, right? The body says, hey, I want to protect myself. How am I going to protect myself? I'm going to create a muscle spasm. And so that muscle starts to spasm, and that causes fixation. And when you get fixation, you get a condition called a loss of imbibition. Okay? Now, imbibition, another fancy term, but basically in the lumbar spine, we have these discs in between the vertebrae, right? But those discs don't have proper nerve supply. So we have to have a condition whereby nutrient gets into the disc and toxic chemicals come out of the disc and the waste comes out of the disc. And the way we do that is by pumping the disc and pumping the lower part of the spine. So when you have to have proper motion, okay, proper motion of the lower spine. I'm trying to get my proper motion of the lower spine in order to get this imbibition process whereby we're getting nutrients into the disc, we're getting waste and toxins out of the disc, and that leads to a healthy disc, right? But when you have fixation and you don't get this imbibition, the disc will start to disintegrate, you will start to get dehydration, and you start to get toxic discs, and that leads to desiccation, dehydration, loss of disc height, and all different kinds of problems as it relates to that. So we also know when we get this fixation, the body says, hey, I want to protect myself a little bit more, so what am I going to do? Oh, well, let me compress. And when I start to compress, I'm going to start to build bone, and I'm going to start to degenerate. And as I start to degenerate, you get arthritis, you get bone growth, and the whole situation just gets worse and worse and worse from down there. And it all starts with this misalignment. So as chiropractors, our major focus right here is to, we want to create better alignment. We want to get the soft tissue to function better. And we want the soft tissue to be healthier. So we want to keep the inflammation down. If we keep the inflammation down, the nerve irritation is down, the muscle does not spasm, and we have nice movement, nice imbibition, nice healthy flow of nutrients into the disc, toxins out of the disc, and the joints are moving freely and everything is hunky-dory, and that's good. So what happens when you go to the ER or the medical doctor and they're like, oh, no problem, you got a muscle spasm, let me just give you a muscle relaxer. Well, they give you a muscle relaxer, that might release the muscle, but then what, right? Then you still have the same misalignment and you still have the same problems. So as chiropractors, what we try to do is we try to go to the cause of the condition, which is the misalignment, and work backwards. And that seems to work a lot better. All right? So let's move forward here. Let's talk about knee problems. Knee problems, gosh, so many knee problems in the office. So many people coming in with various different types of knee problems. And knee problems can be debilitating, right? They're debilitating. And you get hip problems, you get knee problems, and then what happens? You can't move. And when you can't move, you can't walk. And when you can't walk, you're sedentary. And when you're sedentary and you're not moving, you put on weight. And then the whole cycle kind of keeps moving in the wrong direction, right? So these different type of problems make it so that you can't be active. And when you're not active, you can't move. And so you start to get more sedentary, you put on more weight, and the whole condition just kind of goes into a downward spiral. So we're not just talking about knee problems. We're talking about life problems. And our job here at the cafe is to help people get more on track and to do the lifestyle that they want to be able to do. All right, so let's get into some of these knee problems. Knee problems start, again, knee problems are downstream from hip problems and lower back problems, okay? Now, could you have soft tissue issues in your knee? Sure you can. If you go skiing and you get into an accident and your knee comes in a situation like this and you tear cartilage in there, that is what we consider a macro trauma. And a macro trauma is a one-time event accident. And can that cause problems in your knee? Absolutely, it can. However, oftentimes these problems are starting, like I said, up further. So if you take a look at this diagram, you can see when the femur starts to adduct, right, or kind of move inward, you can see the knee will start to abduct and move in an outward direction, which is called a dynamic valgus condition. And that can create problem on the loss of joint space on the medial side of your knee. You can get medial meniscus issues and so forth. So as you can see, when you have issues in your sacroiliac joint, and that's not moving properly, then you get issues of the rotation of your hip. And then with the rotation of your hip, then you get a valgus stress in your knee, and that can cause all different kinds of soft tissue issues with your knee, all right? So there's lots that can be done for that. If we increase better motion into your sacroiliac joint, get your hip moving properly, take the adduction or the internal rotation out of the knee, and out of the hip, and then we work on the knee as well and creating better motion in the knee, work the soft tissue above that and below that. We have really good success helping patients with these various different knee issues. But when this happens over years and years and years and years, does it start to break down the tissue? Absolutely. And that's where people start to go in and they say, oh, what am I going to do? Let me get a shot. Let me get a knee replacement. This is easily avoidable if we stay on top of the alignment, if we stay on top of proper motion in the joint. We can certainly help patients with a variety of different knee issues. But once again, let me tell you, we're not just talking about knee issues here. We're talking about life. If people have problems with their knee, if they have a problem with their hip, with their foot, they can't be active. And then, life starts to spiral. I see many patients that their life has been turned around by some of these different issues because they can't be active. And movement is life, right? Movement is life. So as you can see, various different types of stresses on the knee as it relates to just rotation inside the hip and sacroiliac and lumbar spine, lack of movement and dysfunction, all right? Foot problems, foot problems, once again, another downward stream condition from lumbar, low back, sacroiliac, hip, and knee, right? If we go back here, we can take a look at the knee. And if we take a look at the knee and we see the valgus stress, then the ankle starts to evert, right? You can get supination or pronation of the foot, and that can cause problems, but it's a downward stream, right? So taking a look at foot problems, lots of people we take care of in the office with various different type of foot issues, all different kinds of sports too. Runners, we take care of a ton of runners, ultra runners, and so forth, all different kinds of foot problems. But let's take a look at the ankle issues, right? So if we take a look at the middle, we have normal ankle aligned properly. If we take a look at the one over on the left, we can see when we start to have various different issues with the hip and the knee starts to go valgus or varus. It can affect pronation or supination of the foot. All right, so let's use the analogy of a car. All right, so if you have a car with brand new tires, okay, but the alignment is off on the tires, what is going to happen? The alignment is off. Yeah, the alignment is off on the tires. what's going to happen to those tires, right? They're brand new tires, but they are going to wear. Nothing wrong with the tire, right? It just has to do with the alignment. And so that's what we see with the ankle, okay? If that ankle is not aligned properly and you're starting to get pronation or supination of the foot, which is most likely indicative of issues that you have going on with your knee and with your hip, then you're going to start to wear down on some of these issues that you have in the foot, right? So that's where we get hammer toe, extensor hallucis longus. You start to get all different kinds of arthritic conditions, plantar fasciitis, all different kinds of conditions that you can get as it relates to pronation and supination of the foot and an altered gait cycle. An altered gait cycle is definitely responsible for breaking down a lot of these different types of conditions that we're talking about today, whether it's hip, knee, ankle, foot. Altered gait is something that we look at quite a bit to ensure, hey, well, what does your gait look like? And then we can get a better understanding about, well, how this is breaking things down. So if we can kind of move backwards and focus on the different issues that we have, whether it's pronation, supination, valgus or varus stress on your knees, internal, external rotation of your hip, we can start to get a better understanding about how we can kind of help get you back on track and work on some of these different problems, all right? Which again, translate to life. It's not just a joint issue. Oftentimes it's a life issue because people just can't be as active as they want to be, all right? I love this slide. Growing old is not for sissies, right? Gosh, I feel it myself. I'm in the gym and I notice that I just don't recover as well as I used to. I can't, I'm still active. I'm still fit. I still move around. But, growing old, you got to work harder for less results, right? You got to put more time and more energy for not quite the amount of gains that you would get in your 20s and 30s, right? I am kind of on the backside of my 40s, approaching 50, and I know that I have to put more time and energy. It's easy to put the weight on. That's super easy. That happens quick, but it's harder to take the weight off. It's harder to lean out, and you just have to put more time in, more energy in, and the gains, they're a little bit slower. But I tell you, they're worth it, right? If you want to be active throughout the rest of your life and you want to grow old gracefully, you got to put a lot of time, energy into it. So growing old, it's not for sissies, okay? Self-care is important. Self-care is super important, right? So we talk about this all the time. Check out the Facebook feed. Check out the blog. We're always doing various different types of videos about what it is that you can do for various different types of joints, right? When it comes to self-care, so important. I feel like I'm always telling patients and showing them foam rolling. Everybody knows how to foam roll, right? Not everybody, but most people at this point, if you're listening to this webinar, you understand the concept of foam rolling. Foam rolling is so important, right? Getting into that butt, getting into your glutes, your piriformis, your IT band onto the side of your leg. Be careful on the knee if your foam roller is too dense. Be careful not to get onto the attachment structures. There's not a lot of meat right there where it attaches to the knee and then onto the hip over there as well where the attachment is. Be careful in that area, but right down the middle where the meat of the belly of the muscle is, get in there, roll it out. Myofascial release in through there is good. Exercise, yeah, you got to be strong, right? You have to strengthen. We talk about a three-legged stool in the office. Let me see if I can get this. Three-legged stool. One of those legs is to get some rhythm with your treatment, right? Oftentimes patients do spotty treatment. I do a visit here, I do a visit there. It didn't work, so it must not work. But we talk about getting adjusted and getting some treatment in rhythm, right? We need enough momentum and enough rhythm to push that boulder up the hill, okay? Only when you get it up the hill can you kind of coast down a little bit, but it takes a while to get that up there. So the first leg of the stool is to get some treatment and some rhythm, get some momentum going. The second one is to change the habits of what's putting us in this situation, right? Habits are important. What are we doing day in and day out that's screwing things up, right? We can do things that are positive and that are kind of moving us towards our direction and the goals that we want to do, or we could be counterproductive every day, doing things that are kind helping us present to the office the way we're off, right? So whether that's a sedentary lifestyle, it's ergonomic work stress, mental stress, physical stress, chemical stress, all different kinds of stresses. That's what we're talking about. So first leg of the stool is getting some adjustments in rhythm, getting some treatment in rhythm, getting enough momentum to actually make a change. The second one is changing the daily habits that you have going on, right? We got to analyze the physical stress, mental and emotional stress, and chemical stress that's causing subluxation and causing problems in your frame. And then the third one, exercise, strength, flexibility, and exercise stability. Very, very, very important, right? So oftentimes we're giving everybody a customized exercise program to help strengthen what's going on for their various different conditions and make sure that they're strong and that they're holding their adjustments, right? We want patients to hold their adjustments for long periods of time. And so in order to do that, we have to get strong enough to be able to hold it. I can adjust you to the cows come home, but if you don't have any strength and you don't have any flexibility and you keep doing all the habits that are causing the problems in the first place, you're really just kind of throwing your money away, which nobody wants to do. And then ice is your friend, okay? Ice. These various different types of conditions, they have inflammation, all right? Inflammation causes swelling, which causes pain, all right? So when you have these acute conditions, ice it. No longer than 20 minutes at any given point in time, but several times, ice it down, okay? These are three very important things that you can do. We can talk about getting the lacrosse ball out and getting into various different types of areas. That's a little bit beyond the discussion for today. But when it comes to the hip flexors, butt, glute, foam roll, lacrosse ball could be a very good tool as well. So squat. A good squat is child's play. Love this slide, right? Everybody should get in a squat position at least a couple times a day. I love the squat position. In yoga, they call it malasana. But the squat position is a great position. Take a look at this. Take a look at this, kid, right? I love this. Head is upright so you can look forward and relaxed. Back is straight and solid. Hips are below the knee. Body in balance. Feet shoulder width and flat on the floor with the weight on the heels. Big chest, torso up. Knees are over, tracking the toes. The knees are apart. Look, the squat is a fantastic position, right? And I believe that everybody should be able to get into a squat position. And if you can't, we have to work towards it, right? Oftentimes people, oh, well, I've got knee, I've got hip issues. Well, if we start to work towards helping with some of these various different issues that we have, hopefully we can get you into the squat position. If we can get you into the squat position, guaranteed we're going to avoid some of these different lower extremity issues that you have in the first place, all right? Highly recommend the squat. We're talking about an air squat here. We're not talking about a loaded squat with 200 and 250 pounds on it or anything like that. We're just talking about a simple air squat, body weight, folks. So what other options are available to you out there for this condition? We have ART, active release technique. Love active release technique practitioners. I have a referral base that I refer to one of my best friends. She's an ART practitioner in the city. She does a phenomenal job. When I screwed up my shoulder doing too much surfing, I went to her and she really helped quite a bit. But ART, that is, when you're injured, you're dealing with the soft tissue injuries, you're working with soft tissue manipulation, and that is all well and good, right? But what is causing these various different types of issues is generally a biomechanical issue. And that biomechanical issue is it upstream? And so do we need to address, for instance, if you're going to an AR practitioner and they're working on that hip flexor and they're working on the abductors and adductors and whatnot, what controls the nerves to those muscles is the lower spine, right? So adjusting the lower spine as chiropractors, we're uniquely trained to address the cause. Okay, when you get into some of this soft tissue, this is already a condition that's happened due to a misalignment and a fixation of a joint, right? So both are equally important, but the soft tissue is great, but you can't avoid getting in, moving that joint, increasing the nerve flow to that area so you can kind of head that problem off in the first place. Muscle technique, manual muscle techniques, those are good techniques as well. Again, very similar to ART. Physical therapy, yeah, physical therapy is good. You're going to get some stretching. You're going to get some strengthening. You're going to get some soft tissue work. But us chiropractors, again, we are working towards the cause. How do you correct the problem? You got to correct the cause. You got to go directly to the cause. Oftentimes the cause is misalignment of that joint, whether it's from the spine or just off the spine, creating better mobility in the joint, getting the pressure off the nerve, allowing the nerve to communicate better to the musculature, proper proprioception, which is how you are, your awareness of where your body is in space. This proprioception, this innervation or communication to the nerves happens where these nerves come out, which is at the spine level as well. So as chiropractors, we're really focusing on the cause of what's going on. And then medical doctors, what are medical doctors going to recommend? Allopathic options, here we go. Heat and bed rest. Does that make any sense? No. Heat, oftentimes when patients come in, they're like, oh, they're coming in, they can barely move in, they got their arm over their spouse or their kid, they're walking, oh, doc, it's so bad. And I ask them, did you heat it? Yeah. Okay. Well, you put gasoline on the fire. And when you have an inflamed situation, it's inflamed, it's irritated, and it's painful already. Then you put heat on it. Those blood vessels vasodilate. More blood comes down, more swelling, more edema, more pain. So please don't heat it. If you have a chronic condition that is it's achy, it's stiff, it's a little uncomfortable, it's very familiar to you, it's just, my traps are super tight, some moist heat is okay. But in most of these situations, heat is not a good idea, okay? You want to do ice. And then bed rest, okay, take a person who's not moving, who's already irritated, and put him on bed rest and make them more sedentary and make the problem worse. No, you got to get them moving around. Doesn't mean that they need to, take a situation where you have an acute situation and overdo it, but you got to get motion, okay? Bed rest, generally not a good thing, right? Got to keep moving. You don't want to overdo it, but you also don't want to be sedentary. That could be the worst thing. And then drugs, don't even get me started about the drugs, okay? When it comes to the drugs, people ask me, should I take drugs? The answer is, well, what are you trying to accomplish? What are you kind of trying to accomplish? Do you want to just mask the pain? Do you want to correct the cause of what's going on? Are you concerned about the side effects of them? And so, kind of got to ask questions about it. Drugs, drugs are a last sort, God bless them, but we have a opioid epidemic in our country for a reason. It's because we are a society that is uncomfortable with being uncomfortable, right? So it starts with Tylenol, Advil, Aleve. That stops working. We start to move to Oxy, Norco, hydrocodone. And, then it starts to move into illegal drugs. We're looking at fentanyl, all different kinds of drugs these days. So drugs, they're a slippery slope, okay? And they should be taken, very seriously. It's not something that you want to jump into. Physical therapy, when I talk to my patients about physical therapy in conjunction with what it is that we're doing, physical therapy is all well and good. It's good. It's just like, hey, some strengthening exercises, maybe a little bit of soft tissue issues. That's all well and good. We provide a lot of that in the office as well. We do a lot of deep tissue work. We have a fantastic manual therapy or massage program where the girls get in there and they really do a lot of great work soft tissue-wise. The exercises and the strengthening and the stability aspect of it, we're constantly giving patients these exercises as well. But, sometimes patients co-manage with their physical therapist, and that's not necessarily a bad thing. I mean, if they can help you with strengthening and they can help you with a little bit of soft tissue work, then by all means. But generally, they're not getting in and moving the joint with consistency the way we're moving it and the way we're creating increased nerve communication to correct the cause of what's going on. Pain management, God bless them, I work with a lot of pain management specialists in the area, and oftentimes patients come to me really jacked up, right? They're in a lot of pain, so they've seen pain management specialists. What are the pain management specialists doing? Well, they do more increased diagnostics, right? Sometimes they do EMG, nerve studies, they do diagnostic nerve injections, or they're doing corticosteroid injections and so forth. Generally, those are things that you want to leave as total last resort options, okay? We want to try all conservative, safe methodologies first before we start to get into questioning about, wow, do I need to do an injection? Oftentimes people want to take the easy way out, right? They just want to just inject it. Sometimes those injections are beneficial. Well, let's not use the word beneficial. Let's say those injections sometimes can help to reduce the inflammation and reduce the pain temporarily, and it's a patch-it solution, right? So sometimes people want to use chiropractic for crisis care and not really for restorative or rehabilitative care, which is better than using an injection for crisis care. But you got to ask yourself, what are you looking for? Are you looking for crisis care? Do you want to just get out of pain? Or are you looking for restoration? Are you looking for stabilization? That's something for you to decide. It's not for us to tell you what you need to have. We're just going to kind of meet you where you're at and try to offer a better solution, right? We know surgery, we know where that goes. So surgery is a last choice option, all right? There is a better way, okay? We want to correct the cause of what's going on with your condition, right? So as we were talking about hip issues, knee issues, ankle issues, foot issues, oftentimes those are downstream from sacroiliac issues, lumbar spine issues. And so we want to correct the cause of what's going on. Remember, subluxation oftentimes is really the culprit in a variety of different issues. When we get joint misalignment, that can create soft tissue damage, inflammation, nerve irritation. That nerve irritation is going to signal the muscle to protect you. It's a natural mechanism. That muscle is going to say, okay, let me spasm here, so I'm going to prevent you from moving into this and making it worse. That will create a fixation. And then you get this loss of imbibition, right? Imbibition, as we were talking about, it's that movement and that pumping of that lumbar spine. If we don't get that pumping, there's not an equal exchange of nutrients and toxins into the disc, and you start to get disc degeneration. You start to get osteophytes back into this area, and that causes all different kinds of problems. And from there, that moves down into the lower extremities, right? You start to get degenerative disc, you start to get sacroiliac problems, then you start to get hip issues, knee issues, and it moves all the way down, okay? So we can treat the feet, we can treat the ankles, we can treat the knee. I don't even like the word treat. I like personally, maybe it's called semantical or whatever. I like to use the word care for. We can care for you with your joints in the lower extremities, but if we don't move upstream and we don't get to the cause of what's going on, and oftentimes these is lower back, lumbar issues, sacroiliac issues, hip issues, then we're just going to continue to have the same problems with the lower extremities, right? So how do you know if you have subluxation? Glad you asked, okay? Well, as chiropractors, we are the only discipline that is trained to look for subluxation of the spine. We use instrumentation. In our office specifically, we use thermography. We use EMG. We use heart rate variability. We use motion palpation, so we're actually moving your body in dynamic motion to determine what joints are moving properly. Static palpation, so we get in there and use our hands. We're looking for edema. We're looking for swelling. We're looking for tone in the muscles. We take a look at your posture. Posture is a window to what's going on. And then we use digital x-ray in the office as well, because a picture is worth 1,000 words, okay? Oftentimes, patients say, oh, I don't want to take x-rays or whatever. I get it. That's fine for you to have those opinions, but you have to look at the risk to benefit ratio, okay? In today's day and age, in our society, going through the airport, microwaving our food, putting our phone up to our ear, there's all different kinds of things that we're exposed to. And so we've invested in digital x-ray to get the best images with the least amount of exposure, all right? So hip pain, knee pain, ankle problems, when we take a look at that, we know that all the nerve innervation for these various different issues are coming from the lower spine, right? So we're looking at L3 through L5. We're looking through L3 and L5. We're looking at the sacrum, and we're looking at the SI joint. This is where a lot of hip, knee, and ankle problems come from. That's the nerve innervation that is controlling all the blood supply that goes down there, and it is also controlling all the musculature that supports the lower extremity as well. So if you have problems with these areas of L3 through L5, and you have a problem with the sacrum, and you have a problem with the SI joint, you're going to have problems with the muscles that are going down to the lower extremities, and you're going to have blood supply issues as well. All right? So we talk about a three-legged stool. I spoke about this earlier. 3 steps to correct the cause, right? Break the bad habits. We got to break the bad habits. If you don't stop doing the habits that are causing the conditions, you're going to continue to perpetuate the problem. We want to add specific exercises. I work with a phenomenal company. Just spoke with the owner this week, David Cruz, with web exercises. We are able to put together a custom exercise program for you to help you strengthen and to work on some of the myofascial issues, to stretch, to strengthen, and to get into the myofascial component. And then chiropractic adjustments. The chiropractic adjustment is a very powerful tool, all right? It will help to correct the misalignment. When we correct the misalignment, that will help to reduce the damage of the soft tissue. That will reduce the inflammation. The inflammation will then reduce, and that will stop the nerve irritation. When the nerve irritation is stopped, the muscle spasm will stop, and you will have better mobility in that joint, which will lead to better imbibition, which more exchange of healthy nutrients into the cell, into the disc, toxins out of the disc, healthy, robust discs, better motion, less problems in your lower extremities. So that is really, what we're talking about here, all right? And so when we talk about how do you know if you have subluxation, all right, there's basically procrastination, right? Don't procrastinate. So if you've been experiencing problems, I was saying earlier on, some of the worst words that we kind of experience, some of the worst words that we hear in our office is, I thought it would go away, right? So procrastination definitely is the culprit for a lot of these different issues. So these are things that you want to definitely get taken care of in the very beginning. It's not something that you want to let go for long periods of time, okay? We have tons of people in the office that come in, well, I thought it would go away, and they wait months, years for these various different problems, right? So if you are listening to this and you're thinking of somebody that you know that needs to have this information, and whether it's yourself or whether it's somebody that you know, don't procrastinate any further, okay? We take care of a lot of patients. We're able to help a lot of patients. We have a high success rate in helping people with lower extremity issues. Certainly lower back, hip, sacroiliac joint. The culprit to a lot of these lower downstream issues is our specialty. We also work with patients. We adjust the extremities. We do adjust the hip, the knee, the ankle, and so forth. So we potentially can be in an area to help. So what I want to do is I want to reach out to the people that are listening to this right now. Okay, so if you're listening to this and you're happy with your level of health, you're happy with the way you look, you're happy with the way you feel, you're happy with the way that you function, then that's awesome. Keep doing what you're doing, and I totally support you in that. But if you're listening to this and you're like, gosh, this really makes sense to me. I'm struggling. I've had knee issues for a long time. My back hurts all the time. My ankle hurts. I can't be active. I've been sitting around for too long. I've been putting on weight because I'm not getting as much as I need to get out of in my life. Then my invitation to you is to call the office, text the office, email us, send in an inquiry through our website, cafeoflifemarin.com, and let us know how we can help, okay? Generally, our new, what we call health breakthrough experience, which is a new patient consultation, a full exam, including all the different things that we talked about before, right? We have nerve system diagnostics. We do the EMG, which is an electromyogram, measures the muscles, thermography that measures the heat, lets us know what's going on with heat and inflammation, heart rate variability, postural analysis, orthopedic neurological evaluations, gait analysis. Normally that can cost $310 in the office. If you contact the office within a week of listening to this webinar, we will do it for $47, okay? But it has to be within a week. We know when we're putting this out. If we hear from you after a week from now, we're more than happy to help you, but the price is $310. Actually, it's $315. But if you do it within a week or you refer somebody in the week and let them know that you saw this webinar, we're absolutely happy to do it for $47, okay? Medicare rates apply. Unfortunately, I got to put that in there because we can't discount these things for Medicare patients. In any event, we want to be able to help people function at a high level, That's our goal. And if we can help you or we can help somebody that you know, certainly we want to be in a position to help. Check out some of the testimonials on our website. Check out some of the testimonials on our Facebook page, on Yelp. We've been helping people in this community for almost, for about 15 years now, and we love to be in a position to help you. All right, if you have questions, comments, go ahead and leave them wherever this is posted, on Facebook, on the website. We'd love to hear from you. Go out. Our job is to help you be as functional as we possibly can. It's been a pleasure. Look forward to catching you next time. Next month, we are doing neck issues. All right? Get rid of neck pain forever. We're going to be talking about neck in August. All right? Have a good one, everybody.